as you might imagine, for sex, nitric oxide is like the king and the queen. Like it's the most important molecule because when you get sexually excited, your nitric oxide levels go up. And that's super important for both men and for women.
Welcome to the JJ Virgin Lifestyle Show with celebrity nutrition expert, fitness Hall of Famer, and 4-time New York Times bestselling author, JJ Virgin. JJ is a warrior mom whose knowledge and expertise have helped change hundreds of thousands of lives with over 3.5 million podcast downloads and appearances on Dr. Phil, Dr. Oz, The Today Show, Rachel Ray, Larry King Live.
Whoa. This show is about you, not about me. I want to help you find practical, real-world ways to dial in your health and mindset so you can finally lose that weight and feel strong and energized. Stop settling for less than your personal best. It's time to find out how to look and feel better than ever. And I'll be right here with you the whole way. Hey, it's JJ, and today's show, we are going to be talking about sex and skin. Probably wondering how the heck those go together, and my guest today is going to show you how they do, and more importantly, really how you can, I always like to call it de-aging, because to me, anti-aging means that you just left the planet. So de-aging or reversing aging, she's going to show you how you can do that today with regenerative medicine. Now, if you've been feeling like, I just feel like I don't have I don't look quite the way I used to look, or, my joints don't feel like they should, or my hair's thinning, today's episode is for you. And I have awesome show notes from today because there's a lot of stuff that came up that I was making notes all along that we're going to include for you to help you put this into action. You'll be able to get those at jjvirgin.com/sex and skin. I had to do that. I couldn't help myself. And that is all spelled out, sex and skin. All right, let me tell you about our awesome guest. It's Dr. Amy Killen. She's an anti-aging and regenerative physician specializing in sexual optimization and aesthetics. And little known fact, we found out about it today as we were doing the interview. She did what I would call the infamous video with my bestie, Dave Asprey. You'll hear about it during the interview. She's an international speaker, teacher, author, and clinical practice owner, and an outspoken advocate for empowering patients to look and feel their best by merging lifestyle modification, hormone optimization, personalized medicine, and regenerative therapies. And she's going to be talking to us today about regenerative therapies, but then also things that you can shift in your diet. There's a big aha in there, and exercise to help there as well. So lots of gold in this interview. There's also some gold in this testimonial that I got from J.A. Murphy, and it's a 5-star review on Apple Podcasts. The title is Making Sense with Your Diet Options. JJ has been on the front lines of the diet conundrum. She knows all of the wild swings that have been part of the opinionated bias of the world of nutrition. She asks the pertinent questions of her guests and has solid knowledge of her subjects for a great podcast. Plus, she's honest and beautiful. Really? Wow. Thank you so much. We were just talking offline, Amy and I, about we always want to know if something's audio or video, because most of the time I'm in workout clothes with a ponytail. And, I've actually been going live a lot more like that because I think we all need to just be real, right? So I appreciate that so much. And more to come on kind of making sense of the whole diet conundrum. I'm really taking that one on. So I think it will help everybody. And you've noticed I've probably been pulling more guests on about that because I really want you to understand how you can navigate all of that without making yourself crazy. All right, we're going to be diving into this interview, but first I wanted to share another favorite with you. Dr. Amy Killen. I love that last name, by the way, Killen. Anyway, welcome to the show. So glad you're here.
Thank you so much for having me. I'm excited.
Oh, yeah. Well, come on. Skin and sex. Hello.
Good topic.
Who doesn't want to talk about this? It's so good, so provocative. So you are, I guess, a former ER doc, right?
Yes, that's right.
And then you kind of shifted into what is called regenerative medicine. And why'd you make that shift? What happened?
I'd been working in the ER for almost 10 years and I had young kids at the time. And I got to this point where I wasn't sleeping and I was super stressed out and I was, eating garbage and I just was not doing well myself. And then I also realized that I was seeing these patients in the ER that have chronic illness. They were coming back over and over again. I didn't have a lot of answers for them. And so I just realized that I needed to figure out how to get myself healthier. And then I could teach my patients also how to be healthier. So I just kind of made the switch pretty abruptly.
Yeah, gosh, that seems like the most unhealthy place that you could possibly work is in an ER. I mean, it's like crazy all the time. Your adrenals, I don't know how everyone doesn't just have totally burnt out adrenals.
Yeah, they do. They all do.
So now, this is super fun. You specialize in skin and sex. What? Hello? What do you mean? Explain this, Amy.
So what happened was when I transitioned over to doing kind of integrative and regenerative medicine, initially I was seeing patients with all kinds of problems, and they'd come in with fatigue and weight gain and depression and all the normal things. And so we would work with them on that, and we kind of get them healthier. And then the next thing they would always come in and say is, okay, now I feel pretty good. Can you help me with my skin and or sex? And it was always one of those two things. Like, it's like they got this foundation of health, and then they wanted to kind of up level into figuring out skin and sex. And so what I realized is that skin and sex actually, if we just focusing on those two systems, if you can get them dialed in, it ends up creating a healthier person in general. So now I just kind of focus on those two areas.
So what do you do to focus on them? Like what are of course, it's totally selfish. I'm going to be selfish here. Because the minute I saw that topic, I'm a complete insano about what things I can do for my skin. And of course, anything that's going to help with sex, I'll have a happy husband. So, so let's dive into that. And where do you start? Like, what's the first thing?
Some of it's just basic health, and of course, you're already doing all of these things. But there's quite a bit of important information that comes from the food that you're eating and the toxins in the environment and your stress and your sleep, and really dialing in all of those things, because all of those issues will directly affect your skin and sex. And so those things are the first things that I work on.
Okay. Then, everybody hear that. And I know, we talk like ad nauseum on this show about eating right and sleep and all of that. So all of that matters here tremendously. So let's assume for everybody listening that they've done all of that. And now they're like, okay, now what can I do?
So one thing that I do like I want to kind of dial in with really quickly on the nutrition that people don't know about, and I'm sure that you do, but is the importance of nitric oxide in nutrition. And
we haven't talked about it on the show.
Awesome. Oh, good.
No, woo. All right, go.
So nitric oxide, it's a chemical messenger in your body. It's very important, and people don't really talk about it. But what it does is it does a lot of things. But one thing it does is it vasodilates your blood vessels, so it opens up your blood vessels. So it's what brings your blood everywhere. It tells your body to open up your blood vessels. So as you might imagine, for sex, nitric oxide is like the king and the queen. Like, it's the most important molecule, because when you get sexually excited, your nitric oxide levels go up in the area, in the genitalia, and you get blood flow there. And that's super important for both men and for women. And what happens is, as we get older, and by older, I mean starting at about age 35 or so, we stop making as much nitric oxide. So every year that you get older, you're making less and less and less and less. And so that's a problem. And it's also a problem for skin, because skin also makes nitric oxide, and it's important for skin barrier function and healing and blood flow and all of these things. So what's interesting is that there are several things people do on a daily basis that they don't even realize they're doing that's affecting their nitric oxide levels, that I can give you little tips on. So one thing is using antiseptic mouthwash every day is actually killing the bacteria in your mouth that are important and necessary to convert the food that you take in into nitric oxide.
Wow. I know our buddy Trina Felber, who gave me the big admonishment about don't use those mouthwashes. I'm like, okay. Yes. So that's a big one.
That's a big one. And then the other thing is the acid blockers in the stomach, like things like either the proton pump inhibitors, which can be like a Prilosec or things like that, or even just the regular acid blockers that you might take, regularly or after a meal. that affect the acid production in your stomach, those things, they have all kinds of other issues with them. But
I know
in this
they're
regard,
evil.
they're evil.
So we've talked evils about them on all other levels, but I love that there's even more evils about them.
It's even more evil because they also, again, they affect the acid in this and the bacteria in your stomach, and you can't make nitric oxide. So doing those two things, not using mouthwash, and then of course you have to eat foods that are high in nitric oxide, and those are things like spinach and arugula and beets and things like that. It could be helpful as well.
Okay, that is awesome and great news. And I especially love the great news about the mouthwash, because I did this entire, it wasn't just enough to ping the fluoride. We've been shifted all over to really cool dental products from Trina. And I will put that in the show notes, everybody. But that is super interesting. Who knew? And we'll also put in the show notes foods high in nitric oxide, so that will help too. All right, cool. So that is a great dietary little innovation that we have never talked about before. So
Good.
Beyond diet, then where do we go from there?
So of course, exercise, and that's actually increasing nitric oxide as well. So that's just one more reason to exercise is you're going to increase your nitric oxide levels.
And what type of exercise?
Any kind of exercise will increase levels, but especially aerobic exercise. So that's excellent for those levels.
Okay, so some high intensity interval training would work well.
Would work, yes, that's perfect.
Right.
And then the next thing I tend to focus on is hormones. And of course, I'm sure you've had people talk about hormones on here before, but they're super important for skin and for sex. And that includes all hormones, the thyroid and estrogen, progesterone, and even things like vitamin D, which is important, for skin and sex as well, because it's important for making hormones. So getting hormones checked, having a doctor that is familiar with those is of course, very necessary.
Yes, I remember talking to one of my functional medicine hormone doc friends about estrogen. It's like the minute it drops, all of a sudden you just see it in your skin. It's
you do,
crazy.
Yeah. Mm-hmm. Postmenopause is not so good for the skin.
Amongst other things. All right, so we've dialed in hormones, we got diet, we're doing our high intensity interval training, and now what are the fun things that you're doing in your office?
Okay, so I do a couple of different fun things. One of them is I do quite a bit with regenerative medicine. So things like stem cells, platelet-rich plasma, exosomes, kind of activating your own body's healing using these sort of
let's define all those
things.
Because assume someone listening has no clue what any of those things are. Let's kind of go through and break it down as to what they are.
So stem cells are the master cells in your body. You have them all over your body, every single organ, every tissue, and they're responsible for the upkeep of your body. So like if you cut your arm and you need to heal it, it's your stem cells that jump into action, and they can replicate themselves, and they can also direct the cells around them to heal that tissue. So basically as you age, it's your stem cells that are keeping those organ systems alive by replicating and directing those areas. And as we get older, as everything as we get older,
you keep saying that.
I know. It's unfortunate, but as we get older, we have fewer stem cells that are actually available to work, and that results in slower healing. It results in less, in your skin, like less skin rejuvenation. And so what we're trying to do with these regenerative therapies is we're trying to activate your stem cells that are already in your body to become more active again. So it's kind of like kickstarting them because they've gotten a little bit lazy as you get older.
Okay. And then what about, what is PRP?
So PRP stands for platelet-rich plasma, and that's just taking some blood from the patient and centrifuging it and then concentrating the platelets in the blood into like this high concentration serum. And the way that we use that is platelets house a bunch of growth factors. They're just in there all the time because the platelets are one of the main, healing factors in your body. So we can use the platelets and we can inject them in different areas of the body to then those platelets will go and talk to the stem cells that are already there and say, hey guys, we need to, let's get to work. Let's make some more collagen. Let's make some more elastin. This person's skin is looking saggy or whatever.
And now you're saying the S word. I will, full disclosure here. I have done both. It was one of the ways I helped my son heal from his traumatic brain injury, his severe TBI. And then I've used stem cell therapy for my knees, for my hips. And then I've done I guess it's called the vampire facelift, the platelet-rich plasma for my face. I mean, I've like done all of this stuff, seen tremendous results. So it is incredible. I think this is a very good time to be aging.
It
Amy.
is. It is a good time. I mean, if there is ever a good time, this is it.
I think back to like my mom, and boy, they just didn't have the options. It was like those bad facelifts were the only option. Now, what
Yeah.
about exosomes?
So exosomes are fairly new. In the last couple of years, we've been using them. Exosomes are another way to activate stem cells, and they actually usually will come from like we will buy them from labs. The ones we get usually are from umbilical cord stem cells, so healthy babies' umbilical cord cells that are grown in a culture, and then they release these exosomes, and exosomes house a bunch of different growth factors that then kind of float around and again activate the stem cells. So in my practice, we use a combination of different types of stem cells, either stem cells from the patient, or these exosomes, as well as PRP. But the overall goal, and the only thing that you really have to remember, is that what we're trying to do is activate your own stem cells to become more active and regenerate the tissue.
So what are you doing specifically with all of this stuff for skin? And you also, I know you're doing this also for hair restoration.
Yes. So for skin, I'll take a combination of these things: as stem cells, exosomes, PRP. I usually oftentimes together, all in one procedure, and I will inject them sort of deeper and superficially into areas of volume loss and into areas where there are fine lines. And then I'll also do microneedling on top of it, which a lot of people have had. But microneedling creates these little channels all over your skin that allows me to get the stem cells and PRP into those top layers of skin when otherwise they wouldn't penetrate the skin barrier. So I do all of those things together for the skin, and what happens over time, and it's usually 2 or 3 months out that people start to notice that.
Yeah, I was just going to ask how often do you have to do it, and how quickly do you see results? What about downtime? All of that.
Yeah, good question. So right afterwards, you're very red. So like a bright sunburn, super red. You can certainly have a couple of little bruises depending on how easily you bruise. That's always possible. But for the most part, within a few days, most people you're back to normal again. My patients will send me pictures after a couple of days, and most of the time they're back to normal. But so it's a pretty low downtime. And then it takes about anywhere from 4 to 6 weeks, you can start seeing improvements, but it really is more like 3 months. And it continues to get better for up to a year, because you're just continuing to make more collagen and elastin and hyaluronic acid, which are all the components of skin that create that healthy, sort of vibrant skin.
It's, when you really look at it, you are out absolutely what I call de-aging, but reversing aging. It's like you're doing the Benjamin Button thing. Now, so do you do it just once? Like, would you do it once a year? Do you do multiple times in a row? Like, what's the...
With the stem cells themselves, because it's a little bit more expensive and sometimes more invasive, patients tend to not do it more than once every 1 or 2 years. But a lot of my patients will do PRP, which is just from their blood, sort of follow-up treatments. Maybe they'll do it at 6 months or a year. But in general, these regenerative treatments that I'm doing are lasting between 1 and 2 years. A big part of it depends on what else you're doing for your skin. Like, are you staying out of the sun? Or at least, sometimes, are you eating well, exercising? All of those things play a big role in how fast your skin ages and how long these things last.
Yes. Gosh, if I could go back in life, they always say, do you have any regrets? I'm like, I regret lying out in the sun with like baby oil on a silver
right. Yes.
That I definitely regret. Why I thought that was a good idea, I have no idea.
Yeah,
so
it's fascinating actually. Sun, and this is something else I talk to patients about. Sun is actually really interesting because, certainly there's a case to be made for not going out with the baby oil, just like you said, and sitting in the sun. And we know that UV light, especially UVA, is going to directly damage the collagen in your skin, and it also prevents you from healing because it messes with the enzymes that heal the broken collagen. So essentially, like, it works in all these ways to just really break down your skin. But on the flip side of that, we also know that people who don't get enough sun have an increased risk of all kinds of other medical problems, from diabetes to different types of cancers and heart disease. So it's like this balance. You really do want to protect your face and areas that are going to be frequently in the sun, but you also don't want to totally hide out and never get sun.
Yes. Don't you think it's like life. It's all about balance. You can overexercise, you can even drink too much water. I have a buddy who's a plastic surgeon, big one in Beverly Hills. And we went out to lunch one day and I go to his office. First of all, he looks like a vampire. He's got on now his total gauze stuff, his hat to go out to walk over to lunch. I'm like, boy, I hope you're cranking the vitamin D here. Because wow.
Yeah.
Yeah. Crazy. Yeah. And then there's the other side of sunlight, and that it regulates your whole circadian rhythm and helps with, your mood and everything else. So I love that that you said that about it being a balance. Now, same thing here. I know that we are talking skin and sex, so we have not talked sex. So let's go there.
Let's go there. Yes, let's do. So I can use the same regenerative treatments, that the stem cells, the PRP, the exosomes. I can use them for both men and women to do injections. For women, it's vaginal injections and clitoral injections, and then for men, it's injections into the penis.
Whenever I hear this, I'm like, ow!
I know.
Seriously.
I give a lot of talks, and whenever I say this in an audience, everyone just kind of like cringes. But we use numbing cream, or patients are asleep sometimes. And so it's actually not nearly the bad experience that you're imagining.
I know our buddy Dave did that video. I was like, don't do this. And, posted that video of him getting it injected. It was like, with his toes curling. Remember that one? I'm like, no.
Well, I was the one who did his injections, and what was funny about him is that I didn't know he was filming, and I have a needle and a syringe. I'm getting ready to inject his penis, and I looked up, and he has a video camera going, and it's right on my face.
Like only Dave asked me.
Yeah, it totally surprised me.
Just for everybody listening, he did not video the actual needle going in. He videoed because it was covered.
Right.
But what you could see was his toes curling as the needle was going in. And that was enough for me. You saw the needle, you saw the toes curling.
Yeah. And I think he said something like ow or something. And I without thinking, it was like, stop being a baby. Or I said something completely dismissive, which was not very nice, but it's not usually actually very painful. It's just a little pinch.
Okay. So little pinch.
Right.
Yikes. And so what types of things will this help with?
So for women, we see improvements. I mean, the main thing is blood flow. So we're increasing blood flow to the area in areas that, sometimes as you age, you get less and less. So we'll see improvements in things like sensation, pleasure with orgasm, just general pleasure. Some vaginal lubrication can sometimes improve as well. I have women who have reported a lot of improvements in stress urinary incontinence, which is, when you jump on a trampoline or sneeze and you kind of have a little bladder leakage. That's a big one that can be helped with these procedures because you're building up a little bit of collagen underneath the urethra. So all of those things can be helpful for women. And then for men, same kinds of things, increase blood flow. So you have improvement in being able to get an erection and keep an erection, sensation, all the things that tend to go down with age or with disease in the body.
Cool. Well, that is so awesome that can fix or at least improve incontinence, because I never got that after having babies, thankfully. But I mean, what a bummer that is to have.
It's super common. And a lot of women, until the last few years, haven't talked about it because they're, aside from doing surgery,
it's not really like lunch conversation.
It's super common. But the other thing that I use a lot in combination, and I like to do combination therapies, is I'll use vaginal lasers or radiofrequency devices, or for men, I'll use Gainswave, which is the shockwave therapy, because these things tend to work sort of synergistically with the stem cell and regenerative medicine procedures to really help to, heal those areas.
Well, that is great. What I love the most here is that your approach is so integrative, that you're looking at everything that you can do to make an impact, which is fantastic. Instead of just going, okay, we're going to do some PRP, it's
right.
Fantastic. Love that so much. And what I'm going to do in the show notes, I know that you've got a very cool little gift for everybody that we're going to put in the show notes. Sex and Skin, top 10 integrative and regenerative strategies for optimal sexual function and skin health. So everybody's going to get that. And again, I'm going to put everything at a link that you will not forget. And that is jjvirgin.com/sex and skin. Spell the whole thing out. Sex and skin, A-N-D. I don't think anyone will forget that, Amy.
It's easy. It's an easy one to remember.
And then you'll get that cool gift of Sex and Skin, top 10 integrative and regenerative strategies for optimal sexual function and skin health. So good. And I super appreciate you being with us today and sharing all this awesome information and things that we'd never talked about before.
Well, thank you. This has been really fun for me.
Yay. So after the break, I'm going to share my top action step from today and a challenge so that you can put this into immediate action. So stay with me. All right. So this is where I throw down a challenge for you. And what I loved today was the information about raising nitric oxide with the foods that you eat. So my throwdown to you, and this is going to be the easiest challenge you ever take on, is to increase the nitric oxide rich foods in your diet. Now, here's the deal. When you hear the top 10 of these, you're going to go, I'm in, JJ. So here they are. Ready? And by the way, this will be in jjvirgin.com/sex and skin. We'll have this list. We'll also have the link to Trina Felber's awesome Primal or Life Organics tooth products, because now that you heard that info, and that was yet another bit of info on mouthwash and the issues with it. And then we will also have Dr. Amy Killen's Sex and Skin, top 10 integrative and regenerative strategies for optimal sexual function and skin health. And here we go. Your challenge for today, if you choose to accept it, and I think you will when you hear these foods, is to incorporate in a high nitric oxide food into your diet daily. Here they are. You bet you're already doing this. Ready? Beets, garlic, meat, and I'm going to say grass-fed, of course, dark chocolate, woo, leafy greens, nuts and seeds, citrus, red wine, pomegranate, and watermelon. So add a little bit of that into your diet each day. That's my challenge for you. I know that was like, you're like, okay, that was a lay down, JJ. Yep. And I just want to remind you, grab those show notes and subscribe and jump on over and leave a review so I can do that shout out for you too. And let us know what's going on. You know, we had an audio problem that we figured out purely because of the show reviews. So thank you so much for that. Turns out the service we were using was uploading in a weird way that had my talking running over the guest talking, because we recorded them on separate little, I don't know what that thing is. Anyway, separate lines. And that's what happened. So it's like going, I'm not talking over people, but it made it sound like I was. And that's how we found it, because people told us. So I super, super appreciate it. Any input, any feedback, please leave a review. Let us know. And while you're there, be sure to subscribe so that you don't miss a show. We're doing a bunch of cool stuff too around the JJ Virgin community, in that we are doing interviews with people you want to hear from. And I seek out really cool people with great information. And then I'm doing my own show. I interview myself based on the questions that you're asking, what information you'd like to know more about. And then Friday becomes Friday Q&A. And that's where I'll be answering a top question. So love to have your participation in any of this and all of it. And I will see you next time. Bye.
That's all for this episode of the JJ Virgin Lifestyle Show, which marks another step towards a healthier body and mind. Don't forget to rate, review, and subscribe to the show, and we'll talk to you next week.